Okay, welcome once again. Welcome to the session 3 of the Master Trainer Program batch 17. If you remember last class, we were discussing about the essential skills. So although we discussed, even the finer details of what our verbal and non-verbal communication should be, but I just tried to, put them under 5 broad skills. If we are able to remember them, and especially when you will impart this training to your team members and fellow professionals, it will become easy for you to kind of communicate to them that if you're able to demonstrate these 5 skills, your patient is going to be happy. You are also going to be satisfied that you could really, attend to your patients. So do you remember the 2 skills that we discussed in the last class? Do you remember?
Rapport?
Yes, the first one was building rapport. I think that's one thing that we don't make any proactive effort to build rapport, because we assume if we try to build rapport, it probably would take time and it will, we will be distracted. So we don't want to talk anything that is not related with the disease or treatment, and we don't care to build rapport. But I think last class also opened our mind to the idea that building rapport does not take time. It's just a matter of, do I want to build rapport? Do I value building rapport? And if, I mean, I've seen it a lot of time. Like, I'll give you a very, very simple example. I went to Haldiram this week 3 times. By chance, I changed my, my social interaction was going down. So I thought, no, I have to meet my family and friends. And then we decided, okay, we'll invite them for breakfast. So I invited, on one day, I invited one part of family. And the other day, I invited the second part of family to Haldiram for breakfast. So there, on the counter, the people who are serving us and who are taking orders. So usually they're kind of, again, they serve, they give the service, but they don't make any extra effort to connect with us. And we just come back not very happy with the way they talk to us or they serve us. Of course, they give everything that we have placed the order for, but then that connection is missing. So I have made this a habit, and that is really greatly helping me. I always go and wish the other person. I mean, not caring who is younger to me, or she's younger to me, or older to me, or is just an employee. No, I would just go and say, "Good morning, ma'am. How are you?" To the extent, even at the airport for the security check, I will always say, "Hello, ma'am. Good morning," to the security officer who would do our, security check, and that brings smile on their face. Suddenly, you feel that they are relaxed. You are relaxed. So at this experience that I'm sharing at Haldiram, I found that when I greeted the people who were serving, I said, "Good morning, how are you?" And then I placed the order and I did everything. I saw that they were more cooperative, more forthcoming. So proactively, I would suggest all of you to try this, and you will love the outcome. I'm sure many of you may be already doing it, but try doing it, and you will see it bringing a sea change in your, energy around you. And same way, you have to tell to your team members whom we are going to train that please proactively build rapport with your patients and their family members. When they come towards us, whether I'm standing on a counter or I'm sitting on my chair, they expect me to look at them and smile and say, "Hello, good morning, tell me how can I help you." That does not mean that I've become a receptionist or I have become, may I help you kind of a person. But that shows that I'm willing to help. I think that is the attitude we need to, inculcate among our healthcare professionals. So welcome, Arshia. Sorry, I wanted to complete my point so that.
No worries. Sorry, I got a little late. I was outside. I'm traveling, so I'm in Hong Kong presently.
Oh.
Gone out for a dinner, and so took some time.
So are you comfortable, or you? I mean, because if you're out.
Yeah, I'm back now.
Okay.
I'm back now.
Thank you for joining. Great. So the first skill that I said, I think that would really open up a dialogue with your patient or with your client, whoever they are, even with your team members, your juniors, your fellow professionals. Okay, that. What was the second skill, if you remember what we discussed? Attentive listening. See, usually when people come to us, they have to either clarify something or say something or ask for some help or clarify something. So if we don't listen to them attentively, they can make out. For example, when I'm giving them a blank look or I am writing something and simultaneously I'm saying I'm listening to you, they're not satisfied. They feel that I am not being heard. Same way when patients come to the clinician, they have their history, they want to talk about their problem, they want to tell what has been, their last night or last day or few days. And when we say, I know everything and we don't need to talk, they feel suffocated. So I hope you remember the last sentence we said that, I mean, there can't be a greater agony than holding the words, in your throat that you want to speak and say, but there's nobody who's ready to listen to us. There's a service in Delhi, I don't know, it may be in other states also, uh, and that is called Saheli. So the service is that people like you and me volunteer in that service, and people who are in great distress, they call on this number. The person who is listening, like trained person who is on the volunteer, they just have to listen. They don't even have to provide any solution or anything. They just got to demonstrate that I'm listening to you, I'm understanding. Yes, that must be really difficult. I'm glad that you manage it very well. It was very brave of you. That's all. That's all. And that's more than a service that the patient wants from us. So, second skill I think that we all have to learn is attentive listening. And if you remember the first class that we did, we are just not listening attentively caused such a serious medical error. It led to patients, irreversible condition. I'm sure you must be observing this day in, day out. Medication error, procedural errors, patient identification failure. I remember a nurse, I was taking a session for a group of nurses. So she asked, "Are you Geeta?" She shared her experience. She said, "I'm in an injection room." And a patient came in and I asked her, "Are you Geeta?" The patient said, "Yes." "Kutte ne kaata hai kya?" To that also she said, "Yes." She gave injection, anti-rabies she gave. And later on, they got to realize neither she was Geeta and nor she was bitten by a dog. But because there was no proper communication, she didn't listen, she didn't understand. And a lot of time, patients also are not able to understand what we say, but they normally would nod because they're too scared to say, "No, I've not understood what you said just." So, second skill that I say that we all must practice is attentiveness. Now, going to the third skill, and that is positive and helpful attitude. I think being in healthcare, it is mandatory for us to have a very clear understanding of what attitude towards patients, towards my work, towards my profession I have. And people who hold negative attitude, that is visible in their body language, that is visible in their communication. So I would just emphasize the importance of positive and helpful attitude through a story. I think that will help us understand why is it important to have the right attitude for our work. So there was a building being made, at one place. So somebody who was passing by that road stood, in front of the building, and he saw a couple of laborers working on the building. So he asked the first one, "What are you doing?" That laborer said, I'm earning my livelihood, I'm getting money, so I'll be able to feed my children and look after their needs. This is my livelihood." So a lot of us work with this attitude towards our work. There's nothing wrong. Everybody wants money. Everybody needs money for their day-to-day requirements. But if that's the only reason, then I think we need to sit and reflect. Is it only money that I'm working? He goes to the second laborer and he asks him, "What are you doing?" He was quite badly irritated. In a very rude tone, he says, "अंधे हो क्या? दिखता नहीं है, पत्थर तोड़ रहा हूं." And I believe a lot of us work with this attitude also. Go to them at any point of time. They're always irritated, frustrated, unhappy, complaining, not willing to help. Go to them, ask for some help, time नहीं है, बाद में आना, अभी मुझे नहीं पता, मेरे पास ऑलरेडी बहुत काम है, तुम्हें कोई और नहीं दिखता क्या? I'm sure you must have come across some people who would always give you these answers. He goes to the third one. He asks him, what are you doing? So he takes him to the side of the building, and there's a huge map hung there, like a notice board. And he says, there's a very beautiful temple coming, and I'm constructing that temple. Same work, three people doing with different attitude. And we all know what we think and believe is what we manifest. When I say I'm enjoying what I'm doing, I'm happy at what I'm doing, I'm releasing a very different set of hormones. When I'm frustrated, when I'm unhappy, when I'm stressed out, when I'm not liking what I'm doing, I release a very different set of chemicals. And the whole chemistry change. And I always say human being is a product of chemistry. Isn't it? So the attitude that we have has to be very, very clear to us. It's not only for the patient or their family member that they would be affected, we will be equally affected. I was taking a session for a group of emergency medicine residents. So I said, normally when your patient goes, what do they say when they go? So one of them said, मैम जब वो जाते हैं तो कहते हैं आपके साथ भी ऐसा हो तो आपको पता लगे. So when my patient says something like this, I think I need to sit and think, what am I doing? Are they really that frustrated with the way I've dealt with them? I always say people working in healthcare don't need to go to any temple, church, or gurdwara, anywhere. This is our Karam Bhumi. If you do your job well, if the patients are happy, the people are happy, they give you blessings right here. This is my belief. You may agree, you may not agree. But this is what I believe. People in healthcare are blessed. They need not go anywhere. Blessings come to them, provided we have right attitude, right thought process, right way of having. So I believe having a positive attitude, helpful attitude is very important, especially when people come in pain, they're suffering, they're looking for some relief. They're hoping that we, being healthcare providers, will be able to understand their plight and will try to alleviate their suffering. And if we act insensitive or apathetic to their suffering, they're really badly hurt. I think that's one of the reasons why we are experiencing so much of aggression against us. Because they're very unhappy with the way we handle it. We do everything, but we refuse to be nice, polite, compassionate, and kind. So this is one skill I think we have to really inculcate among our healthcare professionals. They need to have right attitude. Believe me, once I was taking a session for a postgraduate set of medical students. So one of them said, ma'am, she asked, ma'am, why are doctors expected to have empathy? Why can't we work like engineers and chartered accountants and other professionals? Trust me, for a couple of seconds, I didn't know what should be my answer to them. But then, of course, I gathered my awareness and I told her, see, patients are suffering. They expect us to respond to their suffering in a more, proactive manner. That's why we require them. I don't know how far that really went for her. If that was her question, I don't know what was her thought process. So, but I think that's one skill I say we must have. Willingness to engage in conversation is also a sign of positive attitude. That's all. When they come to us, I'm ready to stand or pause for a second and listen to that person's problem, even that's also a reflection of mind. I think that's very important. It's visible on our face. Face is the mirror of your mind. So it's visible what you are thinking or feeling about the patient. The fourth skill that I want each one of us to thoroughly, first of all, understand, learn, practice, and demonstrate, and that is assertive communication. I'm sure you all know, but what do you think is assertive communication? I think since we are very few in number, you can unmute and speak. Anybody who wants to answer this question. What exactly we mean by assertive communication? Even if your answer is wrong, it's perfectly all right. At least it will tell you what you have been thinking for assertion. We say be assertive, or I am very assertive. What exactly we mean by that? When I say either be assertive or I am assertive. Dr. Pradeep, would you like to answer this? No problem. Arshia?
I think being firm and confident with a lot of conviction, you say something. So, I mean, there can be an aggressive attitude and there can be an assertive attitude where you are being polite, but at the same time, you're being firm on what you're saying. I mean, you're asserting, for example, for a patient, it could be, assertion on, to help them understand the importance of treatment adherence. So,
Okay. And if the patient does not adhere, how do I assert? I'm just trying to get more from you. Don't think I'm challenging your answer, but I'm just trying to get more from you. A lot of time patients don't adhere.
you have to counsel and help them understand rationally, help them understand the importance of adhering to the
Still patient does
treatment.
not understand. Okay, you are recommending surgery. The patient is not agree.
Then you have to, I think it's important to let the patient decide eventually. It's a you cannot assert, you cannot force a patient to do what they want to do. But at the same time, you can give your opinion in a very in a confident manner, and then let the patient decide whether this is what
you're very close to the answer. See, assertion, I think first clarity that I want to make here is assertion is not being adamant on what I am saying is right. A lot of time we say, I asserted, I will not listen to you. You have to agree with me. I'm sorry, this is not assertion. I can say that I'm sorry, I don't agree with you. I understand even you are not agreeing with me. So there is definitely some communication gap and some understanding we need to, have further by understanding each other's point of view. But even if I'm in authority position, my assertion would not be, I know it very well and you don't have to bother. Just listen to me and do it. Again, that's not assertion. That's not assertion. Yes, Dr. Devi.
Ma'am, it could be confident, forcefully putting your view, but taking consideration of the others, matlab, others' views also. If you're asking patient what is his concerns, what he wants, but we have to put our views, our point of view very confidently.
So when everything else that you said was perfect, except forcefully. The moment I use force, if the person is senior to me, the person might retaliate. If the person is equal to me, might argue. The person who is lesser in hierarchy, patients still don't consider equal to us. They feel that they are not, in terms of knowledge and position, they are not equal to us. The moment you will use that force that you're talking about, it would subdue them, it will quieten them. They are not equal partners. In assertion, we consider the other person as equal partner. So when we talk about shared decision making or informed decision making, like Arshia said, that we give all the information. Like everything else that you said was very right. Check their concerns, address their concerns, answer their questions clearly, let them know the truth, even let them know the outcome, even if it is a poor outcome or it is a high risk case. Tell everything. Allow them to take the decision. So if I may say, assertion has 5 elements. You can note down this, because if these 5 elements are there in your communication, believe me, it is assertion. Open, you're open, honest, confident, positive, and respectful. Respectful.
Respect.
I repeat, open, honest, confident, respectful, positive.
Positive.
So as long as you are communicating using these 5 things, in your approach, you are not hiding anything. You are not scared of anybody. You are telling what you want to say, but at the same time, you're respectful. You are considerate of the fact that what I say should not make the other person feel uncomfortable or feel under pressure. At the same time, you're open to listening to the other person. And if in case you think what the other person is saying making sense to you, you're open to even amending your way of looking at the situation. For example, there's a patient who requires cataract surgery, and you are discussing with that patient that you have a hypermature cataract and it needs to be operated. But the patient says that my son and my daughter-in-law, they're busy with their children exam, and for next 1 month they will not be able to look after me. So I wouldn't be able to, come for follow-up and other things. I'll have to postpone it at least for 1 month. So your clinical goals are very right, correct. But the patient's situation is not conducive. And we agree. We say, I think it is not really very safe to wait for 1 more month as you already have hypermature cataract. But then I understand that you will have to come to the hospital for at least 3-4 times after surgery. So we can wait, but then I request you to, regularly visit the at least nearby doctor to get your eye examined, so that we are sure that there's nothing wrong with your eye. Or in case if some symptoms develop, you will have to immediately come to person. But I'm saying that we are having a discussion, negotiation. We are not used to it, I know. See what happens when the patient is in listening mode. We are more than happy to tell whatever we say, they listen. Problem occurs when they're not cooperating or they have their own reasons. A lot of time when there's some kind of disagreement, that is where our composure goes up. So I gave you that questionnaire to check your communication style. So do all of you have your scores with you? The 4 scores that I had asked you to say. Did you say? Asha, have you done that questionnaire? Yeah, you have done it, I think.
I've done it. I
But
could
you have
not
not
save.
saved. Okay, no
Yeah.
problem. No problem. Dr. Pradeep had saved, but then there was some confusion. What you had done, you added these scores of first 5 answers to the second one, and then to the third one, and then to the fourth one. I made the correction. I could notice that. I made the correction. Let me share the screen with you, and I will show you your scores. Okay, before I show you scores, I think I will explain you what exactly that questionnaire was. See, we all handle difficult situations in primarily 4 different ways. If there's some kind of disagreement, some of us just become quiet. We would not speak up. We would not take any stand. I'm sure you must be noticing this a lot of time in a meeting. Some people would come and go without uttering a word. They will not say anything. They will not speak up. They will not share their ideas. They just come, attend the meeting and go. Have you noticed the people around you? So they will just usually withdraw from the situation. And that style of communication is called passive communication. Let me give you your scores simultaneously so that you can, yeah. Michelle, have you noted your scores? Okay. So your first score is your passive communication style score, and that is 9. For Dr. Pradeep, so your first score, that is passive communication scores, is your 13. You can note down 13. The first score is passive communication, and your score is 13. Neetu, your scores are 11. The first score, that is passive communication, is 11. Arshia, for you, it is 10. So you can note down 10 for you, first score. The second way that we handle, so in passive communication, the person completely does not take any stand or does not speak up, does not share the ideas. Now, if we take that stand once in a while, it's all right. There are situations when we think my taking a stand will not make any difference. So it's better to stay quiet. But if that's my regular way of handling situations or disagreements, what is the disadvantage? What is the disadvantage? If you are using passive communication as your regular way of handling situations, especially disagreements, you have a tendency to just become quiet, not to express your ideas, or you put down yourself frequently, or you think, I don't have anything to offer. These people are very smart, intelligent, learned. I don't have any experience, so I better not open mind. What is the disadvantage?
We will get dissatisfied
Definitely.
during our job. It will increase our stress.
Absolutely. Because you're not interacting. All our growth lies in interaction and transactions. So if there is no transaction, there is no growth. Absolutely. And it will lead to a lot of frustration and unhappiness. What do others say?
Your point of view would never be acknowledged or known even to others.
Will not be known because you
Known.
never opened
No,
up.
no.
So definitely nobody will get to know, even if you know a lot, they will never get. Absolutely. Good point. Anything, Mitu, that you want to add?
I think it leads usually to a low morale, and it's like you get more depressed. You want to speak, you don't express, and then it leads to a lot of frustration inside. Which is
Absolutely.
again you don't get happy.
Self-confidence will just be lost, completely lost. Self-respect also will get reduced with time. Morale will go down, like you said. Of course, there will be resentment towards others because you feel that people are exploiting my rights. Your will and wish will never be asked. Will be the last one to get whatever is left over. Arshia, do you wish to add to anything to this?
I
From
think, I think eventually, I mean, everybody has shared those points: lack of confidence, self-esteem.
will work happen?
Sorry.
Will work happen? Suppose if one of the member is
Exactly. Yeah, because that's true. I mean, lack of communication, I think, is the major issue in any relationship, whether it is, at any level.
absolutely.
And naturally, after a point of time, if you're dissatisfied with people around and with your own self,
Mhm.
the work won't happen. And then, usually what happens is when people are passively communicating, then at a point of time, they actually burst. And then
Absolutely.
people will be, and then people will be surprised, oh, what happened to this person? This person was very mild. And so I think it's better to
By the way, why do
um,
people? Yeah, Michelle, I think you have to add something. Go ahead, then I'll ask the next question. Yeah, go ahead.
Yes. I mean, this is just a thought about, will it also show that you're not very committed to the cause?
Yes.
Like,
People,
I mean, it doesn't make a difference to you.
yeah,
I mean, it can be misconstrued as anything, right? If you don't say that.
absolutely, absolutely. By the way, why do people practice passive communication? What do you think could be the reason in the background?
A lot of times they are not confident. A lot of times it can be they think it doesn't make sense to them,
Mhm.
and maybe the audience also. Sometimes the audience is also wherein you think they're not worth of it. Even if you speak, they'll not listen to it.
Yeah, I agree. Once in a while, we all use passive. A lot of time, there's some argument happening. You say, "Oh, let it be. I don't care. I don't want to get it." But if it's my regular way of handling conflicts, then it is very risky.
Then it's
And if you're a team leader, and if that's your way of handling situations, you will never be able to lead because conflicts are bound to happen. Conflicts are part and parcel of any organization. So if you can't handle and if you can't stand them, then definitely, and especially if you don't know how to handle them. Usually people adopt passive communication because they want to avoid conflict. They fear rejection. They fear if I say something and if people don't agree with me, or I'll be mocked. People will laugh at me. So they actually fear rejection. And of course, at the same time, there'll be a lot of frustration and anger because you are not able to open up. So you're unhappy with yourself. And that might come out as like Arshia said, it might come out as volcano and they might bust. So once in a while, using passive communication is fine. But if that's my regular way of handling situation, then things will not move. I will not be able to lead. Things will not happen. People will not respect me. People will exploit my rights. People will misuse power against me because they know I won't voice, I won't say anything. So your first scores are your passive communication styles. More often than this, people use passive aggressive communication style. Now, as the term clearly says, passive aggressive, to look at you are quiet, but internally you are very disturbed. You are unhappy, you are frustrated, you are dissatisfied with everything. So these kind of people who use passive aggressive communication, they will not speak in this situation. But after everything is over, they'll go and talk. They will not talk to the right person, but they'll go and talk to others and complain and blame and find fault and talk all sorts of things. So people who are passive aggressive, they will not take a stand when they're in a situation. They will not even take responsibility. Give them any responsibility, they'll say, no, I already have a lot of work on my head. I'm sorry, I won't be able to take it. They may genuinely actually be busy, but then they need to voice and say that I'm sorry, I already have 4 projects in my hand. I won't be able to manage the next one. But then they'll go out and say, मेरे को गधा समझा हुआ है, मुझे ही सारा काम देते हैं और किसी को क्यों नहीं देते हैं, अपने favorites को तो light work देते हैं, अच्छा काम देते हैं, मुझे सारा. I mean, they would just go and talk like this. Again, the reason is that they are afraid of asserting. They think if I assert, I will be rejected or I will be targeted or people will not like me. So again, these kind of people, they will not, speak for themselves, but they'll speak later. They'll talk ill about you. They'll talk ill about, and they may even sabotage your work. They will not cooperate. Very often you will get to hear, oh, I forgot. I left it. I didn't realize. These are the excuses you will get to hear from them. So your second score is your passive aggressive communication score. And let me tell you the scores. Michelle, your score is 6. I think you know it. Dr. Pradeep, your score is 10. Second score is 10. Mitu, your score is 10 again. And Arshia, your score is 9. This is your passive aggressive communication style. The third way of handling a situation is when we become aggressive. A lot of us, when we are not able to hold our anger, we lose our control and we try to start arguing. You will often see people who are quick to become aggressive. So they may suddenly, their voice might be loud, or their tone will change, their body language will change, their eye contact will be angry and intimidating, especially if they're in authority position. You will see that they would try to shout or find fault or become aggressive. Maybe even they hit the table, and their body language will show that they're angry and aggressive. There'll be a lot of negative energy around them. They may even become loud and they may belittle others. We have seen people talking like this. दिमाग नहीं है क्या तुम्हारा? समझ नहीं आ रही क्या? कितनी बारी बताऊं तुम्हें? This is how they. So again, people who are using anger and aggression, they have to remember, if that's my way of handling situations, people may not speak in front of me, because if I'm in authority position, people will become quiet. Then they're not happy. The moment they'll get a chance, they leave me and go. Very often we get to read this on LinkedIn. People don't change jobs, they change their bosses. If any one of us is an aggressive boss, you are at risk. Your people will leave you and go. So your third score is your aggressive communication style score. And let me tell you the score. Michelle, yours is 9. You already know it. I think you have written. Dr. Pradeep, your score is 9. Neetu, your score is 16. And Ashia, your score is 10. And the right way of handling situation is assertion, like we discussed. You have to speak. You must express yourself. If you don't agree, you have to communicate that I don't agree. But then again, you can say, I'm really sorry. I'm sure you have a point to make, but I'm not able to see your point of view. I need time. I need little more information from you to understand your point of view. So score-wise, Michelle, you are 16. Dr. Pradeep, you are 20. Neetu, you are 20. Arshia, you are 18. So from your scores, all of you have your scores now? From your scores, what is your understanding of your communication style? Especially after we have discussed all 4 styles. Do you agree with your scores, and what is your understanding of your scores? Let's start from Michelle.
I'm still trying to make sense of it. But I think the passive communication a lot has to do with my organizational structure and how, even though I'm in a managerial position, I also have super bosses to report to directly. And so there's a lot of decision making that doesn't involve me and gets made about my team. So I think a lot of times, rather than going in and being pretty aggressive or saying something out of context, I wait.
Michelle, in your case, I think your score 9 or 6 are not high. I will not call them high. But your score 16 is low. There's a lot of scope where you can improve. You need not reduce your passive communication. You need to improve your assertion. See, systems will not change for us, but we have to create our way through our communication. More you will, and I'll talk briefly about what assertion is and how do you practically do it. I'm going to, because I want to empower you with this skill. I want each one of you to work on it so that this becomes your primary way of handling all situations in all ways of life. The rest other should be only when the thing is working and you say, I'm done. But otherwise, assertion is the only way to communicate. And you will see it will pave a lot of way for you. Even in organizations who are very close, when you learn how to assert, people start valuing your expression or your idea, because they know that you don't talk nonsense. You will talk to the point, but you make sense. I think you can work on your assertion. Okay. Next is Dr. Pradeep. Dr. Pradeep, what is your understanding of your scores?
Mhm. Sometimes we have to follow the orders of our top management bosses. So there, I have to be more polite but firm to put my my views, uh, and I have to be uh, more considerate about my juniors also. I had to take their uh, I had to take consider of their situation also in which they are working, what are their point of views. So that way it may help.
So going by your scores, I think you are quite assertive. It's perfect 20 in your case. But at the same time, I see your passive scores are 13.
13.
That means in certain situations you are taking a passive stand, and you very rightly admitted that especially when you're dealing with people in authority, you are likely to become quiet. I think that's where you can, practice more assertion and see how you are able to communicate what you think. You don't have to trust your opinion on them, because I know you can't do that with your seniors. But in a subtle way, if you are able to communicate your ideas and your thought, it will, and also through your actions, if you are able to demonstrate, people will start valuing your, opinion more. Because going into passive communication is you're withdrawing. Somewhere, internally it causes resentment. And then, of course, we blame the system and people and everybody. But I always say work on yourself rather than working on people. People will mirror you and use this, very beautiful secret of psychology. People mirror your behavior. The brain functions on the concept of mirroring. And when you practice something, people start falling in. Try doing that. That's what I do with in most of the situations. Okay, going further, Mitu, what is your understanding of your scores?
I'm immediately confused actually, seeing my aggressive score. Like, but I think that's the profile I handle because I am more into auditing. Every time I have to put my point, and it goes at a top management role, and the all vice presidents of the company. I have to tell them that this is going wrong with you. So assertion, थोड़ा सा arrogance में हो जाता because everyone's fighting. And for QA, I think it becomes survival of the fittest at that point of time.
So very, 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 very interesting that I can observe it. See, Michelle says she's at the second or third level in the hierarchy. Dr. Pradeep also says he has some higher up on his head. Mitu says that I am in the higher position, so I have to be aggressive. See, that's how we look at situation. I haven't heard Arshia. I will be listening to her. But see how people justify their behavior.
Yeah, and what happens is it's a startup culture, and in startup everyone's so aggressive. The timelines, everything's like ऐसे चुटकी में, and that would at one point. So if I go to passive communication, you want to say no, it can't happen, but there's like no,
Passive में
it
तो जाना
can't
ही नहीं है
happen.
ना, पैसिव में जाना है ना पैसिव एग्रेसिव में जाना है, एग्रेसिव में भी नहीं जाना, बिकॉज एग्रेसिव में यू आर डूइंग योर हार्म. You shout when you get angry. Internally, you can't be happy and peaceful. You give what you have within you. अरे भाई नींबू निचोड़ोगे तो नींबू का रसी तो निकलेगा, आम थोड़ी ना निकलेगा. So to give poison, you have to create poison. To give anger, you have to create anger and aggression. And that would only come when you will release stress hormones. Pleasant hormones के साथ चिल्ला नहीं सकते हो, है ना. That means जिस वेसल में जो होगा वही बाहर आएगा, पर वो वेसल भी खत्म हो जाएगा.
So I was given a feedback in my communication with my CEO that I have to be aggressive. I don't speak up. I like
Because people don't know the power of assertion. That's not their fault. Most of the people think if you are not aggressive, people will not listen to you. I disagree. Assertion is such a powerful skill once learned. It is something like learning to drive and swim. You will never forget. And it's so powerful. It gives you so much of confidence in yourself that when you talk, people will have pin drop silence.
Yes.
But it comes with lot of practice. I'll come back to more explanation about it, but I want to listen from Arshia. Arshia, what is your understanding of your scores?
I think I mean, not from scores, but I know what what I do. So yeah, I get into of course, when there is authority. I mean, I speak out, I assert myself. I've learned that, along the way. I was also given a feedback by my boss at one point of time. You need to be more assertive. And, so he felt that I'm too soft with people. So I am giving that feedback sometimes. I've learned to be more assertive. But yeah, I do. But it takes courage to be assertive and to speak out, especially when you feel you're being. So, for example, small experience at present, I feel in my organization I'm not being given the kind of work I'm hired for. They're giving me the work that is a level less, so now there's this conflict. Should I just go and speak about it, or say, this is not the kind of work I want to do, you've got to give me good work. So that's so the question is how to really assert in a manner which is not aggressive as well, which does not make people feel that you're being too what do you say, difficult, or also not get into the passive communication point of view where you're giving me work which one can get into a lot of times, okay, sometimes aggressive as well. So I think my scores are going I don't understand exactly how you score that, but yeah.
In your case, Arshia, what I understand, there's a lot of scope to learn more assertion. And you have admitted yourself that you have received feedback that you need to be more assertive. When I say assertive, it is again not like being rude and firm and aggressive in your approach. You put across your thoughts in a manner, but you have to like the example that you gave. In this case, you will have to do your homework also before you go and talk to them about the key responsibility that they have assigned to you. Whatever you are doing, if you say I won't do that, I will do only what is my job. Again, that's going to further conflict. That's not what you want. But there are so many ways to find the right place and right to work through your good work. So sometimes it is not that I will not do this, but showing that I'm capable of doing much more than this. And that's through your work performance. You will have to kind of demonstrate that. But at the same time, I can see your three scores are almost equal, 10, 9, 10. That means you are alternatively using these three styles, especially where you are not able to assert. See, most of you have got highest score on assertion. So I'm sure you all must be happy that, oh, I assert, I'm asserting. But the twist in this story is that you try assertion, and when assertion does not work, your second highest score style comes into place. So if I take Mitu's example, she tries assertion. If that does not work, she's more likely to become aggressive. She'll try assertion, but when things are not happening the way she wants, there's a possibility that she'll become assertive. Whereas if I take Arshia's case, so she tries assertion because her highest score is 18. But if that does not work, she might take any of the three ways, because if it is somebody senior with whom she has to assert, she'll either use passive aggression or passive communication. Or if it is somebody junior to her or equal to her, you are likely to become aggressive in that situation. So if I take Dr. Pradeep's case, so Dr. Pradeep, you will try assertion, but situations where you think assertion will not work, you are more likely to become passive in that situation. You will withdraw from that situation. That's the message. The second interpretation of the scores is at workplace, you are assertive, but in your personal life, your second highest score comes into place, because that's actually your natural way of handling. situations. So I think this is one skill I say that every healthcare professional must work on, because in public dealing, there are a lot of situations when people demand something that is not doable, or they do not agree with what you probably are explaining to them, or their expectations sometimes are unrealistic, especially when it comes to outcome. They expect, I'm paying so much, so I must get this outcome. And we all know that money cannot be equated with the outcome, especially in healthcare. It's not like that you are paying for a five-star hotel and so you get high five-star services. So these are the situations where you need to really, spend time talking to people, negotiating with them, explaining them, listening to them, which requires a lot of patience and also open-mindedness, where you listen to their point of view and then you explain your point of view with patience, and also kind of come to a point where you're able to create win-win situation for both the parties. So people who assert, they are more likely to, use a communication style which is more like communication between two equal people. So just to, explain you how assertion should be done in all situations and in all occasions. See, we can divide communication in three parts, assertion in three parts. First is language. So language throughout our interaction has to be respectful. Whether it is patients, whether it is our colleagues, junior colleagues, or people who are, much lower in hierarchy, there's a possibility that people who are lower in hierarchy, with them we lose the composure and we lose the respectful way of interacting. A lot of time we go down to, aggressive language with them, especially if they are lower in hierarchy. As I said, sometimes I see consultants literally shouting at their residents in a very loud and, aggressive manner. But when we are asserting, we have to be mindful of our language. Can you think of something that we say which is not appropriate when we are asserting? Can you give some examples? You can take from your own situation, from your own work situation.
I have one. Something on the lines of, I told you many times not to do that,
Ah,
or I've repeatedly told you not to.
mm,
I have a much elderly gentleman who serves tea. And especially when I'm in my consultation, especially with patients, he will walk it with my chai and keep it on my table. And at that point, maybe the patient is crying or it's a very like tense situation, something has just been said. And it just like changes the entire thing. So after the session gets over, when I see him one-on-one, I notice that I've said this.
Good. So a lot of time when we say, "Tumhe samajh nahi aa raha kya?" And then with that, we have aggressive facial expressions and tone of voice. It's very, foul way of communicating. So language, we have to be careful that it has to be respectful. No derogatory language, no abusive language, no foul ways of snubbing others. Second part is tone of voice. So when tone of voice modulation. So when we are asserting, the tone of voice has to be firm but friendly. It should be clearly audible, because a lot of time when we are internally disturbed, the tone of voice either becomes, aggressive and rude. And when we are scared, the tone of voice goes down. But it has to be audible and respectful, firm but friendly. The volume, again, the moment we become aggressive, the volume goes up. And when we are scared of a situation, the volume goes down. the volume has to be kept like we normally talk. If you're talking to a person, one. Even the speed of talking. When we are angry, the speed of speaking becomes faster. Whereas if you are able to actually slow down a bit, your communication becomes more impactful. So rather than increasing your speed, even if you reduce the speed by 1 knot, your communication becomes more impactful. So volume, speed, tone of voice has to be, kept in mind, especially when people become aggressive, the volume goes up, speed increases, and tone of voice also become loud. So that is not assertion. Part 3 is our body language. So, and most important is your eye contact and your facial expressions. When you are asserting, always make eye contact with the person and speak. Because when you make eye contact, the other person gets to realize that you mean it and you are serious about it. And you want the other party also to listen to you or take you seriously. So make sure that you make eye contact. At the same time, eye contact should not be intimidating. A lot of time when we have an aggressive, eye contact, people get intimidated. They are not comfortable. They will not speak up. So like I think I showed you last time also when we say, बोलते क्यों नहीं? मैंने बोला तो है बताओ. जवाब दो ना, आप बताओ मैं तो सुनने के लिए तैयार हूँ. So you see the words I'm using, the tone of voice and my facial expression and eye contact. All are, they are incongruent with the expression I want to be. So facial expressions have to be friendly, but again firm. More like I want to be taken seriously. If you are looking like pleading, you will not be taken seriously. If your facial expressions are communicating intimidation, people will not be comfortable with you. So you have to have a serious facial expression, but non-threatening. It is always preferred to sit and talk rather than stand and talk. Because the energy to fight goes down when we sit and talk. It is also a good idea to signpost in case if there is something important that you want to resolve with the person. Always let the person know that I need to talk to you about something. There's something that's been bothering me. I need to speak to you about it. So when you signpost, they're mentally prepared that you want to talk to them. And then of course, when you talk, the other person listens. But when the other person speaks, you also give enough attention and importance to what the person is saying. You don't interrupt, you don't cut them there, you don't try to explain, you don't try to justify, you just allow them to speak. And then maybe you give your point of view. And then also try to find something that is common between you and the other person, which you think is working well. So for example, if you have worked with that person for number of things, then you say, I think all this while we have been really doing very well. But I think on this particular issue, I think we need to sit and see what exactly we need to do about it. So what you are saying that not that you are completely wrong or bad or not doing well, but this is one thing that we need to resolve. So in workplace, with your colleagues and with your patients and their family members, it's very, very important to learn assertion. It's a learned skill. It comes with difficulty. And you will see when we will talk about all the difficult situations, especially handling uncooperative patient party, managing complaints, disclosure of medical error, in all those examples of situations, we will use a lot of assertion. And you will see how helpful that is to communicate whatever you want to see. So that's skill 4. And then skill 5 is empathy. So we all experience 4 kind of emotional responses to a situation. For example, a patient comes in, I'm in emergency medicine, patient is in pain, I'm doing something. I don't lift my head and look at the patient. I continue doing what I'm doing. I know there's a patient sitting on my left, but I don't stop working or I don't ask them what it is. I know the patient is in pain, patient attendant is around, but I take good 2-3 minutes to even finish my work and go. This is apathy. When I'm not sensitive to the other person's suffering or pain or condition, this is apathy. Now the patient's attendant comes and starts fighting with me. What is this, ma'am? I've been here for 10 minutes. We have brought the patient, you're not even looking at the patient. Now this patient's attendant has insulted me in front of so many people. I'm very upset. How can you talk like this with me? In the heart of my heart, I say, I'm going to make you wait for another 2 minutes or 10 minutes. Antipathy. A lady comes with the child is unwell, maybe fever or some condition. Mother is crying. Seeing her cry, even I start crying. That is sympathy. Empathy is when I can understand the person's suffering and not that much, but I also think how can we relieve the patient's pain. So it's going one step further. I think that's one skill that has to be part and parcel of our persona. If we are not empathetic, we are not sensitive to the suffering and pain of people, I would say we are not fit to be in healthcare. So it is feeling in tune with the person's affective state. And we don't have to cry. I'm not, a lot of time when I ask, people, why don't we practice empathy? By the way, why don't we practice empathy? Unmute your device. Why, Michelle, I'm saying something.
Question is, why don't we practice?
A lot of people don't express empathy.
They're probably a little scared to get in touch with their true feelings, or probably will be judged for feeling a certain way.
I think there is a fear that if I practice empathy, I'll be attaching myself with the patient. Whereas that's a very wrong understanding of the word empathy. Empathy is a cognitive process. It's not an affective process. You know that you are not creating any relationship with the patient, but you know that you can relieve the patient's suffering. You are capable of doing it. You understand their pain and suffering and you try to relieve them. That's the true application of empathy. And it's very empowering. Also, at the same time, I think it gives you a lot of satisfaction. People who practice empathy, they have actually reported a lot of satisfaction and happiness just because they are practicing. Any other reason, Dr. Pradeep, what do you say?
Pardon, ma'am?
Why don't people practice empathy? Why don't people express empathy?
Maybe workload, or they don't have that much time. But ideally, one should put ourselves in their position to understand what's going on with them. then we can understand. Or maybe actually we have been teased. It was not in our teaching curriculum.
Mm.
We have been become more clinicians, more about um, uh, advising the uh, uh, laboratory test and and
That is what one of the student told. When I was taking a session for the medical student, one of them said, "Ma'am, we have been actually asked not to emotionally, engage with the patient. So we are asked to buckle up our, close our, put a lid on our emotions." I said, "I never asked you to emotionally engage with the patient. You don't carry that burden with you. You do your best, and that's all. And that's a skill to be learned again, because we think we are going to attach ourselves or we are going to be emotionally drained. That's not empathy. That means we don't have clear understanding. In empathy, we just see how we can make the person feel comfortable, wanted, accepted, respected, not judged, still cared. That's all. Yes. And we know we have the ability to do it because we have been trained, we are qualified, we are capable of. And that's a very empowering thought. But incidentally, I see people, doing everything but not expressing empathy. Yes, Michelle, go ahead.
Ma'am, I had a question. So, is it also possible that people who don't receive empathy in their maybe personal lives or in their normal day-to-day dealings are also finding it hard to actually learn a skill such as empathy or try and be empathetic in a situation? Like, what if they come from dysfunctional background? So,
See, I agree, but I think once you make this as one of the important virtues and you train people, especially now, if you see emotional intelligence is being given a lot of importance, and people are getting such programs done for their hospital staff purely on emotional intelligence. People get to, I know, I mean, especially with men folk, they're taught not to talk about emotions, not to express, not to talk, not to ask, not to interact. But then that's not the way. We all know everybody should respect and explore and enjoy emotions because they are part and parcel of a living being. But it can be cultivated.
so it kind of boils down to attitude in a certain sense.
Absolutely. So these are the 5 skills I would say whenever you take some session for anybody, emphasize on these 5, and I think most of the things will be covered in this. This can be one of your basic topic when you start teaching communication to your team members or anybody. That acquire these 5 skills and we are good to go. Building rapport, attentive listening, positive and helpful attitude, assertion, and finally empathy. Any questions about what we have discussed before we move on to the next topic of discussion?
Ma'am, is there a name for the questionnaire that you had sent us?
Communication style scores.
Communication styles.
Communication style. And this is a very useful tool. You can you can actually use it. The booklet that I have emailed, that soft copy, towards the end, I think it has the same questionnaire. I have added it. Yeah.
So I have a question, Dr. Hindu. So in practical terms, I mean, for physicians who are seeing like 50 patients a day, 100 patients a day, or something like that, is it possible for them to maintain, in the day, understanding the human factor of, which we all are. I mean, somewhere I feel, for example, in any other profession,
Mhm.
we are allowed to make mistakes. But probably, in the medical profession, because the stakes are so high, we are not allowed to make mistakes. But still mistakes happen, and still these attitudes are there. Have you seen, at a long-term period where, such a curriculum has been imparted to a set of doctors? Is there a long-term study or something which has proven that, this can change behavior in the long term?
Arshia, in Indian context, I don't think there are very many studies, honestly, because people are not open to even doing any study or research on this particular topic, because this is a very raw area. It brings out their vulnerabilities, so the people don't want to explore into it. I did try to design couple of studies with some hospitals and medical colleges, where I try to, see the impact of training on the doctors and their communication. For example, people working in ICU. So I offered that we will do a pre-training assessment of the patients. What do they feel about their, satisfaction with the communication of the doctors, and even the doctors' satisfaction with their communication. And then we will impart them a short training, and then we will, do the post-training assessment by collecting patients' feedback and also the feedback from the people who attended the program. But usually hospitals are not open to the idea, because because they fear that if it comes out, then it will be like something against them. But of course, there are a lot of studies in the other countries where people have, seen the impact of training on people. Because see, of course, I know there are personalities and there are people who come with very different core values and very difficult to change. But a lot of people change if they understand it, understand the need and importance of doing it. They do integrate. And you see, even the communication in the younger doctors now, they communicate better than what our seniors used to do. Because for them, if you talk about the super seniors, they were very communicative. They knew how to win their patients' confidence. But in between, somewhere we lost that, importance of communication and connecting with the patient. So we became more mechanical. Now, of course, I see a lot of young doctors doing a lot of good interaction with the patient, because they feel that it's important to talk to the patient. And they are practicing it. And especially, for example, this particular module that they have introduced since 2019 in the medical curriculum, that's called ATCOM, Attitude, Ethics and Communication module. So I'm sure in the time to come, maybe in 5 to 10 years down the line, we will see a change in their way of communication, because then it will become part of their training. The problem with the this particular set of doctors is they have never had a training where they learned how to communicate.
Because I see a characteristic, communication style with dentists. I mean, that has been my observation. They are, when they will be very welcoming, and most of the dentists have found this. So I was just wondering if their curriculum has
Nothing. I haven't taught in her dental colleges. No, there is no training. But let me tell you, see, most of the dentists are in private practice.
Yeah.
Their livelihood it comes from the patient. They know if they want to win their patient, they have to be nice and kind and understand. But incidentally, most of the medical, of course, now we have private and government medical colleges. But then in medical colleges of the hospitals, government hospitals, patients, there are ample of patients, and they are not directly paying to any doctor. So therefore, they don't really care to win the patient's confidence or to engage the patient or to make sure that the patient stays with them. And a lot of doctors who have not learned it in the right manner or who do not have these skills, they fail in their private practice. You will not see very many doctors doing very well if they don't have good communication skills. you will not see them doing very well in their practice. There was a time, even if they were rude or they were aggressive, they had very good practice. Now patients don't go to the doctors who are not misbehaved. Okay, so moving further, the topic of discussion is designing a program. Because as I said, these two topics I have integrated in the program because I hope and I expect that you will be taking this training further and you will try to train people. And also learning how to design a program will give you a lot of understanding of even when you are, planning a session or a talk in a conference, it will help you prepare yourself for that. For example, I'm going tomorrow to Hyderabad for a session at two hospitals, two units actually, two different hospitals of the same organization. So I sent them a questionnaire to get them filled up from the participant. So they said, ma'am, don't worry, when you will come, we will give you the list of participants. I said, I don't need the list. I need to know my audience. I need to see what their background is, what their qualification is, what their training needs are, what are their key responsibility areas. So when you design a program and if you're able to keep all these things in the background, automatically your program gets refined and you're able to deliver to the patient's needs. So if I ask all of you, how do you design your program? As of now, how are you designing your program?
So it's really customized on the needs and the target population we are going. So if
Okay.
I have to go for a training for nurses, it's going to be a little more, my skills and everything would go in some other way. With doctors, I work the other way. And the senior leadership, it's totally different. So it's
So
usually like that.
you said training needs and also my audience. I keep in mind when I'm designing a program. Okay, great. Anybody else who would like to add to what Neetu has said?
I agree with her. Uh, Basically, first of all, what will be the target audience to whom I have to give training? So the structure of training will be different for that. And if I could find what are the problems there, if there is any special concern, um, those whether the employees were too rude or they are doing more medication errors. So I will structure according to that also.
Absolutely. Wonderful. So that means training needs you keep in mind and also your target audience. Anything else other than these 2 points, Arshia or Michelle?
Mine usually is a mix of both theory as well as some practical sessions. So I would have maybe skills that we talk about from a theoretical point of view from the knowledge component. So that is one. And also have a lot of open-ended conversations with trigger videos. So just to kind of get a discussion started. And what I've realized over a period of doing this, maybe last 7, 8 years, is that role plays aren't very effective when you have less time. Because it really makes the other person uncomfortable. There's a lot of judgment. And if the group is a little scared, then you kind of make them feel more worse. So what we've decided, or we've started doing is case-based discussions. So we'll put a case and then we ask them questions about how would you handle it, what are the skills you use, and break them up into groups.
So, Michelle, I think this program will change your understanding and your skills on doing role plays.
Okay.
Because that's one thing that really, brings a sea change in their understanding and skill level. And every time I do a role play, and I normally ask this question, what pedagogy did you like in the program? And it comes out that role play or the demo that I give them, that we could really see the finer details of course, we will be doing it in the time. So I think 5 key questions that we need to keep in mind when we are designing a program. The first is, what is the goal of the training? Why this training? What do I want to achieve? That is first one. Goal of the training. Like you mentioned, what is the training need? Why do we need it? Second question you have to ask yourself is, who is my audience? That also you have already mentioned. It's very important to know who is my audience. Am I talking to doctors, nurses, paramedical staff, technical staff? So I need to really customize the content and delivery accordingly. The third question I have to ask is, what is my core message? What is my core message? So if you saw the last session that I covered, I said my core message is whenever you are talking to your team, tell them that these 5 skills you should keep in your pocket. The moment you wear your uniform, put these 5 skills in your pocket, and you are good to go. So there has to be a core message. And short and crisp the message, easy it will be for them to remember and implement. That is true. The fourth point is, how am I going to communicate my message in a most impactful? So that's what I said, the pedagogies that I talked about. How do I see people deliver programs using PPTs, and they talk and they lecture, but we have also seen that it is not a very impactful way. People literally sleep. So these 4 questions, when you will ask yourself, you will be able to clearly compartmentalize everything in the right way. The first thing, like all of you mentioned, is to do the training need assessment, to see what is the training need. So how do you normally do the training need assessment? Write in the chat box. What are the different ways to do the training need assessment? Write in the chat box. Because there are multiple ways, so therefore I'm asking you to write. Okay, feedback. Feedback from patients, from others. Okay. Incidents, audits, communication with staff, mandatory session like safety. Okay. What do others say? Send a screening form asking them why they think this session may be important. Have they had prior experience, reasons for why they were suggested this training? So you are going to do a training, but before the training, you need to know what all do I need to cover in the training? What is the training need? Or what do they want? That's one way. And like Dr. Pradeep said, feedback from the patients, from the seniors, from management is a very good way to know what are the training needs. Sorry. Okay, I'm so sorry. I went to the previous, that means it is holding even the previous. Previous chat is also saved, it's not gone. Yeah, okay. So on-site observation is a very good way to see what is the training need. If you go and observe personally, you'll get an idea. See them interacting with patients or their family members. You'll get an idea what they need to learn. Also, like you said, feedback from the management, from the patients, from seniors, from co-professionals also is a very good way to kind of do the training need assessment. Complaints and suggestions that you receive, complaints and suggestions you receive also is a very good way to find out what the training needs are. There are tools available to check the knowledge and the skill skill assessment and knowledge assessment. These are also good ways to do the training need assessment. Certain sectors use mystery customers. I don't think we use that in healthcare. But in a lot of automobile industry, they use mystery customers. Yes, Mitu, you wish to say something?
We do a lot of mystery customers and the mystery shopping just to check how the experience and how the people are dealing. So we do it.
Because your whole thing is on phone call, so it's not difficult to. Am I right?
Yeah, so also because we've got a lot of labs also and consults and the B2C, B2B experience. So therein we do visit, we understand how the things are happening. A lot of time we go with a phlebotomist also when they're supposed to go for a sample collection. And we would be there on the spot understanding how the things are happening.
That is on
There are two ways of doing it. Yeah.
So based on this, you will be creating your training objectives. So training objectives could be just to create awareness. For example, people have no idea, so you need to create awareness. Or you want to sensitize them. For example, they are not really doing it in a very courteous manner, or they are not, attending the patient in a prompt manner. So you want to create awareness or sensitize them that this is not the way, this is the right way of doing. Like you wrote, it could be a mandatory training that you need to do, maybe about safety or biomedical waste. So you need to, create awareness and make them aware of the procedures and protocols. Induction program that we conduct is also done with the idea to align them with the organization's vision, mission, and purpose of the organization. A lot of training is done to build skills of the people, because they don't have the skills that we require. The other day, I was speaking to somebody, and they said that we do, a lot of skill training for freshly appointed nurses, because they come with the degree, but then they are not really, good at skills. So they need to really learn how to do procedures, and we do clinical skill training. So that way we have number of objectives that we might have for a short program of say 1.5 to 2 hours program. You can't expect a skill change, but then you can of course expect awareness or sensitization or change in attitude in people. So when you want to impart some new knowledge, new skill, maybe it can be a beginning of it. But then for a serious change in the say behavior modification or skill imparting, it requires rigorous input, and then it requires review program. Now, based on the training needs and training objectives, now is the time to create content. How do you create your content? How do you create your content for your program?
Note is based on the existing policies, some literatures, and maybe some standards what we follow and what we intend to follow. And some are learning from the incidents where again we want to change the way the things are happening. So content designing is almost on the.
So if I talk about communication programs, for example, if this is something you will have to impart, for example, you're planning to do it, how will you create your content? Arshia, you wish to say something? See, those
Can
are,
you come again? Yeah. Can you come again?
I was just asking, how do you create your content?
Okay. I think first, once we have the pulse of the audience and understand the training needs.
No, all that is done. Training need is
Yeah.
already decided, objectives are decided. Now I'm sitting and preparing I'm planning how do I really, develop my program and how do I deliver it. So I'm focusing on the content, because I need to see what all I want to give. Of course, It will be based on the training needs and training objectives. Now, see, for example, those who are seasoned trainers, they'll have a lot of, background understanding of the issues, and they will know what I want to talk about. But those of us who are fresh into it, so we need to really, get deeper understanding of the subject. So we'll have to do some reading, maybe watch some videos, maybe see some presentations, read more content to see what all we can add to our program. So I use a tool called eDraw Mind Master. Has anybody heard of it?
Pardon?
eDraw Mind Master. So it has both paid and free version. I'm using the free version, which is good enough for us. So I'm just going to share with you the, I mean, it is available on App Store, you can get it. And I'll show you the sample. So normally what I do when I want to create content on something, naturally we all start having ideas that I can talk about this, I can cover this, I can add this. So what I do, I use this tool to which topic should I? Okay, this is a recent topic I covered: strategies to combat stress in medicine. Give me 1 second to reduce this. Yeah, is this screen visible to all of you?
Yes, ma'am.
Okay. So what I do, this is more like a whiteboard for me. Normally, see, when you write on a whiteboard, there's a possibility something might get rubbed off or you might forget. So this is more like a whiteboard where everything is there in front of you. So what I do, there's an option called floating topic. So what I do when I click on this, I can write anything in this box. So I can create multiple floating topic boxes on the screen. Whatever ideas come to my mind, I keep writing on the floating topic. That way, whatever points I have, I will not forget anything. For example, if I feel, oh, this particular activity will be really useful, so I write, okay, this activity I can, use in the program. Or this story will be very useful, so I write story on this. Whatever ideas come to my mind, I write on this whiteboard. Once it is like I feel now I have enough content, then what I do, I organize it in major 4 parts. One is the beginning. Second is body, what is going to be part of the content, and then how I am going to conclude, and what is the takeaway from it. Now, if you see, I have now already organized these points in an order, that setting the tone in which I will be talking about introduction, and then some studies that prove that there is a lot of stress in this profession. And then how are we handling these stresses? What are the signs and symptoms of stress? And then what are the strategies that we can use to combat stress? So that way, what I do, I create a white board for every topic that comes to my mind or I'm preparing for. And I would have multiple, like for example, design thinking in healthcare. This is another one I recently took. So again, I would create a lot of floating topics, and then those topics I will ultimately align in a manner so that I bring them in a. Give me a second to stop sharing. Yeah. Oh. So same way you can write on your notebook. I somehow prefer this tool, and the free version is good enough for us. So you can use this tool so that you have all your ideas on one page in front of you, and then you can be organized. Now, once you have created the content and you have brought in some flow in the content, okay, this will be part of introduction. This is where I'll be doing the discussion. This is how I will be concluding. A very important point here is developing your training pedagogies. So what different pedagogies are you using as of now? Write in the chat box. Presently, what different pedagogies are you using in your programs? Sorry, Arshi, I missed your answer. I saw it now. Take a pulse of the audience, understand their level of understanding, take a survey. I hope you're noting down these points because these are not part of the soft copy I've shared. What different pedagogies are you using as of now? Storytelling, experiential learning with case studies and examples. Okay. Arshia, you said Michelle, you said you are using case studies, no? Yeah, Dr. Meetu says simulation, storytelling, plays, games involving the audience and group activities. Absolutely wonderful. Very nice. Open discussion. That's another good. Especially with adult audience, it is very important to do something engaging. They can't just be made to sit and listen to what you are saying because they also have, if not equal, good knowledge about what you are going to talk to them. So they just can't be made to sit and listen. So very important here is make sure, okay, theoretical concepts, icebreaker, case discussion. Absolutely. So see, we have to become comfortable using like things like role plays or puzzles or ice-breaking activities like Michelle, you were talking about. Group activities like Meetu has mentioned. Videos is a very good way of, communicating your message, especially, difficult concepts. When you're able to show through video, it really works very well. Storytelling, of course, as you said, is a very common way. Experiential learning is also, a very good way. Creative visualization, that's another good way of engaging your audience. So what I'm trying to say, make sure that you have a mix of everything. The more activities, more engaging ways you have in your program, more impactful your program. So it's very important to spend some time to create activities, to create stories, to create puzzles, to create role plays, case studies, to engage your audience. Once you have set in the activities or the pedagogies that you have decided, now is the time to create course material. So what are we going to do? For example, for 1.5 to 2 hours program, maybe you will give one handout, 1 or 2 page handout. But for a long program, it has to be a handbook. For example, for your program, I think you have around 70, 80 pages booklet, which covers almost, much more than what we are going to discuss in the program. So that way, accordingly, you will have to create your course material. There has to be some handout, some takeaway, so that if they want to revise or revisit the content, they should have something to look back. At the same time, now you also have to develop pre-test, post-test, and feedback. Very important. Because it will give you an idea about the impact of your program when you do a pre-testing. Pre-test also helps you to help your audience know that they don't know everything. I'm sure you will have some questions which are answered in the program, and you don't expect them to know everything. So pre-test will help you communicate to your audience that I have something to offer you. So pre-test, post-test, and feedback. After this, execute the training and then take feedback. It's very important to take feedback. And feedback should be simple, to the point, and preferably anonymous, especially when you're taking it from juniors. See, in our group, the feedback form that I give you all is with your name, because I know you would communicate very openly and honestly with me. But generally, when you take feedback from your juniors and from your bigger audience, they would not be very comfortable mentioning their name. So it's better to keep it anonymous and reflect on the feedback. I normally do not close the feedback form till I've received feedback from all the members. I'll go through everybody's feedback, read it, see what I can improve, what I can integrate in my future session. And the more you will reflect on it, better your performance next time. So this has to be a regular way of designing your program. Now, a couple of things that will help you to design a successful program. The first thing that you have to keep in mind is mode of training. Is it online, on-site, or off-site? So what difference will it make? Suppose if it is an online training. So what do you think will be different for an online training? The one is on online training, you really need to have engaging delivery of the program. A lot of time we see people are listening, but they are not listening. They don't even have their cameras on. They are not interacting. You're not asking them questions, so they are not, whether they are there or not, you have no idea. So for an online program, you really need to be thorough, not only with your content, but also with delivery. So you really need to know, how am I going to engage my audience? Also for online program, ask the organization, whoever has asked you to do the program, to keep the audience size to 20. Because we can see 20, 25 people, on one screen. But then to interact, I think 20 is a good size. Maximum is 25, maximum. Even for the on-site session, if the program includes role plays and case studies, again, it's better to keep the audience size to 25 to 30, not more than 35 at any cost. Otherwise, you will not be able to engage. For an offsite program, then I think the topic will be more, learning through fun ways. So again, there you will have to really integrate a lot of physical activities and actual intense activities where you are able to communicate your. I think Meetu, there is some light problem at your end.
Yeah, the electricity is gone.
That's okay. You are comfortable?
Yeah, I'm comfortable.
It's very hot. That's why I'm asking you.
It's fine.
Okay. So it's very important to be, very, have deeper understanding of what has to be a mode of training, what should be the audience size, and then how will you engage your audience, and all that should be planned much in advance. Why is it important to know who is your audience? Of course, you said that we need to know because we need to customize the program. What other benefits will you have if you know who's your audience? And what else should you know?
With the kind of language.
Language can be used. See, knowing their qualification, designation, experience will help you prepare yourself the kind of audience you're going to deal with. For example, I did a couple of
training.
Yeah, Arshia, go ahead.
The level of training, for example, if you're doing a consumer awareness, you need to, what is the level of, knowledge that you're going to give to them? And of course, like Michelle said, language would be more a layman's language. But for a medical professionals, it has to be very, very, and it can be completely in the medical.
Exactly. So with the younger generation, again, you can expect if you're not able to engage them, they can actually derail your session. So you really need to be prepared to engage with them at their level and make sure that they become comfortable with you in your session. Also with senior, set of people, a lot of time they are not very happy to come and attend the program. And if they're asked to come and attend the program, they'll make all efforts to derail your program. I think I did share with you that I was taking a session in one of the government hospitals, and they were all doctors, and one of them was very senior consultant. He was actually retired from the administrative position, but he was still working as a consultant in the hospital. So I had that caption of the title of my session was importance and relevance of communication in healthcare industry. So the moment I switched on the laptop and it was seen on the projector, his first question was, or rather not a comment was, you can't call healthcare as industry. Healthcare is not industry. So, I've been into training for almost like 35 years now. And 2014, I don't know why, no, there was some incident that happened. I'll share with you in the next class, that I decided that I need to really, check my training skills. Am I really updated? Am I really doing the training? So I took this training with Dale Carnegie. I don't know how many of you know Dale Carnegie is a very well-known organization in the field of training, and they do train the trainer program. 2014, I paid 45,000 for a 3 days training, and I attended that program. And it was a very rich experience, very good learning for me. I learned a lot of new things. I integrated a lot of, and that's what I'm now sharing with all of you, because I feel as a trainer, you should have all this in your kitty, because you never know what kind of audience you may come across. In the next session, we'll be also talking about how do you handle difficult audience. So there we will be talking about that part. But then, because I had attended this program, I had attended the Dale Carnegie program. So this doctor, when he said, you can't call healthcare an industry, healthcare is not industry. So had it been my old self, I would have fought tooth and nail with him to prove that how can I call healthcare industry. But I knew I'm not here to argue with him. And we have to pick our battles. Very politely, he said, you don't agree with this title? No. Healthcare is not industry. Thank you so much, sir. I'll keep in mind. So that's how you will have to really learn to handle difficult situations. You will get all sorts of audience. Youngsters sometimes can completely push you off the stage. And sometimes very senior people also. One experience that I had was in one of the hospitals where the doctors from the residents association, they were there with an agenda. And they tried to derail my complete session. But fortunately, people from the management were there, and they got up and they said, sorry, we can't talk these things at this platform. But then I also learned now when anybody tries to talk about things that are not related to the topic, I very politely say, I understand your concern is very genuine, but then this is not the platform to discuss. Even if I try to answer your questions, that's not going to help me. I think you need to speak to your management and get. So that's how we have to, be smart at handling such situations. That, of course, we'll be covering in the next session when we'll say, how do you facilitate that? But right now here, if you know your audience, you are mentally ready, what kind of challenge you can expect with especially with senior audience, very learned people, qualified people, professionals. They would come with a mindset that I know everything, but what are you going to teach? Then, of course, how willing is the audience? That's another question to be asked. A lot of time, you get to know that they're not very interested, especially if the program is organized by management, participants are employees. If the program is paid and people have paid for the program, they may be willing, but they're still skeptical of your competence, of your program, of your delivery. But there, of course, you know that they're committed and you are able to win their confidence. If you are thorough with your work, you will be able to ultimately win their confidence. But mostly when you will do such programs, especially for communication, honestly, if I may tell you, you will not get a lot of people who are willing to attend. So you will have to really integrate what is in it for me. So please note down this. In your session, you have to integrate what is in it for me. Also, some activities, some pedagogy that helps them see that we think we know all, but we do not know. For example, the activity that we did on listening about that patient Neeraj, if you remember session 1, I think all of us got the realization that yes, errors happen and they happen right in front of us, and we are the one who commit such errors. Only thing is we are not caught. That's where we are happy. We all make mistakes. So you have to see how you have to kind of make them settle down and see they're going to be benefited. For example, when you talk about violence and then litigation, they value it. They value it. Yes, I fear litigation. I fear violence, so I must learn. That's how you will have to, integrate these issues in your session. Also, how much is the allotted time? That's very important. A lot of time, you will have a lot of content. As you will continue doing your program, you will have a lot to do. It will become very difficult for you to actually deselect what to leave and what to keep. So you will have to be really good at designing your session in a manner to make sure that you don't go beyond 5-10 minutes here and there, nobody minds. But half an hour, 45 minutes, nobody will be happy with you. How much ever interesting, enjoyable your session is, people are not going to come next time. Oh, they say 2 hours, they take 3 hours. So if you say 2 hours, 15 minutes, they will be okay. After 15 minutes, they'll be watching, looking at their work. So make sure that you time your session in a manner, and you also keep an eye on the. Normally, initially, I used to always have a wall clock. When I say things to be, kept ready, to be ensured that they are there. One of them is the watch in front of you, wall clock. Not for the audience, but for you to keep an eye on the time. Right now, I'm sitting in front of you, but I have a wall clock right in front of me. And I keep an eye on the wall clock, where we are, how much time do we. So that's very important. Some of the things that you have to make sure that you have checked beforehand. One is the physical setup of your place. If it is in the same premises, please go and visit your auditorium or your lecture hall, wherever your program is. If it is far off place, ask them to send pictures. Like, for example, I'm going to Hyderabad, so I requested them to send pictures of both the auditoriums, wherever they are doing. So they send me a picture, so I have a mental idea what the training room is going to be. So visit the physical setup if you can visit yourself. What is the sitting arrangement? Preferably, it should be around a table, so that 3-4 people around a table, because then you give them some activity, some group work to do, they will be able to engage better. But a lot of places, they will just have chairs. That's okay. You can make them circle and semicircles and make them. But preferably, it should be table with 4-5 chairs around it. If you have the option. Projector, mic, audio, video, rejection, please check beforehand. Otherwise, they sometimes fail you completely. Your program can go haywire. It will take away a lot of your time in case if they are not arranged, before time and they are not checked, especially the lead. For example, if you carry a laptop and it has a different set of connector, make sure that you carry your connector with you because sometimes they will not have that connector and you will be turning from pillar to post. Now, what do I do? Then, of course, whiteboard, wall clock, I have mentioned, name tags. That's a very good way. With your audience, if you can have their first name on the, left or right shoulder on a small cardboard in capital, it helps you connecting with your audience. So, for example, when I talk to all of you, I prefer to call you by name and then ask you to speak. You automatically are alert that she's interacting with me, so I have to respond. I mean, if I just say, okay, what do you think? Then everybody will think somebody else will answer. But when I say, what do you think, Arshia? So Arshia knows that she's talking to me. So make sure that you have, name tags. Stationery, whatever is required, you can inform them and let them have a copy and a pen. In case if you're going to use some activities, then you require some questionnaire. For activities like props, if you require uh, some questionnaire if you're planning, then physical printout if you require. I normally use now a Google form rather than using printout because that way you save a lot of paper. So I avoid printouts. Then of course, toilet facility, water facility, tea, coffee, that has to be ensured so that there is, things are available. Now, a couple of things that will again help you to deliver your program, impactfully. Make sure that your beginning and your end goes very well, because that's very important. To make beginning and end very, very impactful. Normally we say, well, begin is half done. Right in the beginning, if you're able to engage your audience, they get interested, you're good to go. And end your session in a manner that there is a takeaway, there is a learning. As I said earlier also, make sure to integrate what is in it for me. If there's nothing for them, they will not enjoy. How are they going to be benefited by learning what you're going to teach? If you're talking about biomedical waste, nobody is interested. But if you tell them that if you don't know how to handle biomedical waste in the right manner, you can get harm. Needle stick injury can cause HIV, can give you hepatitis. Then they will know, yes, it's very important for me to learn how to prevent or manage. Or when you are discarding, different items, how and why should you discard in a manner? So that, especially when you're talking to housekeeping people who are managing the waste, they need to be taught to use, heavy duty gloves and then shoes when they're handling sharp items. So when you tell them that you are the one who is going to be affected, nobody else in the system is going to be affected. That's where they learn why I need to learn how to handle balance. So that's how when you are able to integrate that, they learn. Then create, opportunities where they experience, oh wow, that's something I really love. Create a lot of experience. That's very important. And engage all parts of brains. See, listening activates one part, visual activates another part. But when you engage them in doing something, then they're listening, their visual, their imagination, everything is activated. So all parts of the brain get activated. Studies have shown this. So when you engage them into activities, all parts of brains are. And another important way to engage adult audience, which we are going to talk at length in the next one, is ask thought-provoking questions. Rather than giving information, ask questions. Convert all your information into questions. And whatever information you give, make sure that you support it with opinion, with your with data and some reference. When you say something and when you have a source mentioned under it, automatically your statement becomes authentic. So make sure that you make a mention of the source of what you are saying. Keep updating your knowledge using different ways. Read books, read material, read articles, learn new skills. So that will help you to really, stay updated. And also, see, people will ask you a lot of questions that are not related to particular topic. But then if you are able to answer them, they feel that, oh, you are knowledgeable, you know your subject well. And that will build their confidence and trust in you. As I said earlier also, normally we, go haywire on time. So time has to be really kept in mind when you are designing. Regularly reflect, take your feedback seriously, read the feedback, reflect on your performance, and based on that, keep modifying your program. Every time I do a program, if you see the videos that are already uploaded in the on my YouTube channel, the first batches and now your batch will be very different. You will see change in the only thing that can improve our performance is practice, practice, practice. So my last question to you is, have you heard of the concept of 10,000 hours? Concept of 10,000 hours. No.
No.
Studies show that when you invest 10,000 hours into anything, you become a master of that subject.
Can I add?
Sure.
So basically, it was if I'm not wrong, it was a BJA article in which it was for pediatric anesthesia. So if you want to learn anything, then you have to spend 10,000 quality hours. It takes 5 years to become perfectionist. Whether you will learn guitar, whether you will learn flute, or in your field.
Absolutely. You're very right. Very right. And then actually that's true. The time that you invest, slowly, it starts running in your body. You're always working on it. You're always thinking of it. And that automatically becomes part of your everything for that matter. So designing, when you structure your program in this manner, the way we have discussed, so you will go with a lot of clarity. Like, for example, if I'm going tomorrow to this place, Omni Hospital, Hyderabad. So this is my plan. 3 hours program I've written. What is the topic, time, plan, session 1, then steps, what I'm going to do in each topic, session 2, what I'm going to do in. And I have it in copy so that I will also be checking, am I able to do according to the plan or am I going wrong? I'll come back and I make sure that I make a outline, a plan, detailed plan, and then I also review it after I have done it so that I know where I have gone wrong, what I need to do. But when you do it in a structured manner, then and at the same time, you're flexible. I'll be talking about all this in the next session when we talk about facilitating the program. So you don't have to be rigid. No, this is what I'm going to do, nothing else. A lot of time, your audience will be very different from what you were told. You will have to really, flip. But then you need to have that flexibility to flip without getting disturbed. We'll talk about that in the next session. So any questions about designing a program?
I had one.
Sure.
What happens if you have to do it with another person who might not be like-minded?
Sorry, come again.
What happens when you have to do the program with one other person who might not be as like-minded in terms of how the workshop or the session should go?
So I think again, if you are really not very comfortable and you think it will affect the quality of the output, it is better to raise your concern. See, there's a very beautiful saying: change the things that you can change, accept the things that you cannot change. So if you think you can change your partner, if you have the option, without causing any hurt or upset. Change your partner. Bring it up at least. Talk to that person that this is what. But in case if you know there can't be, nothing can be done and it has to be done by two of you, then it is better that you have clear understanding who is going to cover what. And nobody steps over each other's head.
I'm currently dealing with something
I
like
know.
that.
I
So,
know.
yeah, and it's obviously with a senior person. So then again, it becomes very hard.
Yeah, I know. I am.
I mean, say it out loud, but yes, something that I put out was like very, like a flow plan.
So उसमें मिशन ये है कि जब मूवी में एक एक्टर होता है, एक हीरो होता है और एक हीरोइन होती है. But a lot of time we see a side hero play such a powerful role that in those 5-7 minutes they're actually able to take the complete limelight with them. And to say this, एक तो हम जैसे नॉर्मली कहते हैं कि दूसरे की लाइन को छोटा करने की बजाय अपनी लाइन को बड़ा करना, है ना? That's one thing we say. Work on yourself, don't work on the other person. And this I learned long ago when my husband mentioned something. So he's an ophthalmologist. So he was in a hospital where a young lady, ophthalmologist had joined from AIMS. She had done her MS from AIMS and then she did her FRCS and then she came back and she joined this hospital. So there were already a lot of professors, senior people, in the department. So very beautiful thing that he said to me, which is still with me for now also. It's almost like 30 years I'm talking about. He said कि कुछ लोग दूसरों पर भारी पड़ते हैं और कुछ लोग दूसरों को हल्का महसूस करवा देते हैं. Do you see the difference? जब आप भारी पड़ते हो तो दूसरे को मतलब हल्का, मतलब उनके लिए भारी पड़ जाते हो. There's no need to do that. आप अपना काम इतने अच्छे से करो कि सामने वाला अपने आप ही समझ जाए that you are heavier than him. You don't have to prove that. I would say focus all your energy on your performance. जितना भी वो दे आपको, आप इतना अच्छे तरीके से करो that slowly they start having this confidence that she can do better than me. I hope it helps you. Any other question, any comment, any question? So if no question, no comment, I'll give the feedback form and I request you to complete it before we close. Is that okay? Give me a second. I've shared the link in the chat box. I hope you are able to open it. I received 2 responses, 2 more to come, and then we close it. So
Ma'am, there
we
was,
yes, go ahead, please.
yeah, ma'am, you had shared 4 points on designing
Mm.
the program.
Uh-huh.
So one was goal of the training, who is my audience,
Mhm.
and what is my core message, and what was the fourth one? I was not able to write that
How
point.
am I going to deliver my message? What is the way I'm going to use? Pedagogies, basically.
Better watch.
Yeah, I think all of you have done it. So thank you so much. I know it's already 10:20. We are 20 minutes late, I would say.
1 o'clock at my place.
What time it is?
1 o'clock
Oh my goodness.
in the morning.
Morning, okay, morning? AM.
Yeah, I mean 1 in the morning, 1
Oh,
a.m. It's
thank
two
you,
and a
Arshi.
half hours.
Oh my goodness.
Yeah.
Thank you, Arshi. I think it's difficult to stay awake for so long, and then also you're in another place. So you're returning this week, or you are going to be there?
I'm returning day after.
Okay. So we'll be meeting next Wednesday, unless something comes up. Otherwise, Wednesday is decided. Thank you so much.
Thank you, ma'am.
Good night.
Thank you, ma'am.
Bye.
Good
Thank you,
night.
everyone. Good night.
Thank you.